Hello friends, welcome to Agrim Medical Concepts. Friends, a new study from the University of South Australia has revealed something very surprising. Yes, actually, the common analgesics like paracetamol and ibuprofen may actually make bacteria resistant to antibiotics. Yes, friends, researchers at the University of South Australia, led by Riëtie Venter, have made a surprising discovery. In their laboratory experiments, they exposed gut bacteria like E. coli and Salmonella to common painkillers like paracetamol, ibuprofen, naproxen, and diclofenac. They found that these bacteria not only survived but also developed the same genetic changes that usually appear after antibiotic exposure. In simple words, painkillers were mimicking the effect of antibiotics, pushing bacteria to evolve resistance. Researchers found ibuprofen and paracetamol not only drive antibiotic resistance when used individually but amplify the resistance when used together. Findings of this study are of particular concern for aged care residents who are more likely to be prescribed not just antibiotics but also pain, sleep, or blood pressure medication, making it an ideal breeding ground for gut bacteria to become resistant to antibiotics. This South Australian study investigated the use of 9 non-antibiotic medications commonly used in aged care as well as ciprofloxacin. Assessing the interaction of the non-antibiotic medications and ciprofloxacin on the common gut bacteria E. coli, researchers found ibuprofen and paracetamol significantly increased mutation frequency, making E. coli highly resistant to the antibiotic. Worryingly, the bacteria were not only resistant to the antibiotic ciprofloxacin, but increased resistance was also observed to multiple other antibiotics of different classes. Associate Professor Venter said this thing. And she said that we also uncovered the genetic mechanisms behind this resistance, with ibuprofen and paracetamol both activating the bacteria's defenses to expel antibiotics and render them less effective. Associate Professor Venter said the study is a clear reminder that we need to carefully consider the risks of using multiple medications, particularly in aged care. This doesn't mean we should stop using these medications, but we do need to be more mindful about how they interact with antibiotics, and that includes looking beyond just two drug combinations, she said. Professor Mark Morgan, who is Royal Australian College of General Practitioners Expert Committee Quality Care Chair, encourages general practitioners to constantly consider deprescribing when treating patients with multiple medications in light of the growing evidence around antibiotic resistance. So the message is clear here. We should not stop using painkillers, but we must be careful with polypharmacy and avoid unnecessary long-term use. Doctors also emphasize that importance of deprescribing whenever possible. So antibiotic resistance is one of the biggest healthcare challenges of our time, and now even everyday medicines may be playing a hidden role. And soon I will be back with the new set of questions, for example anti-pseudomonal antibiotics and clinical case based questions related to antibiotics. So stay connected for maximum benefit and efficient learning. Thank you. Thanks.